Hello everyone, we welcome you back to our YouTube channel. Today we'll be discussing about the part 2 of NVS Nursing Officer Official Answer Key. If you have watched our last videos, we have uploaded till 20 seconds. Only the first 20 questions were uploaded. Now we'll continue from 21 till 50. Total 50 questions was there in the NVS Nursing Officer related with nursing. So without further ado, we'll go straight to this question. When does the government of India launch National Mental Health Program NMHP? Option A 1989, option B 1982, option C 1992, option D 1972. The National Mental Health Program was launched in 1982. Correct answer here is B. Next questions. Which type of diarrhea is common for a child with Crohn's disease? Option A exudative diarrhea, option B motility related diarrhea, option C secretory diarrhea, option D osmotic diarrhea. The correct answer here is A, exudative diarrhea is correct answer. Next questions. Which of the following muscles is called non-striated muscles? Option A non-plane muscles, option B skeletal muscles, option C smooth muscles, option D cardiac muscles. Correct answer here is C. Smooth muscle is called non-striated muscles. Next question. When the embryo can be differentiated as human? When can the embryo can be differentiated as a human? Option A 4 weeks, option B 6 weeks, option C 2 weeks, option D 8 weeks. The correct answer here is D, 8 weeks. 8 weeks is correct answer. Next question. Which of the following is responsible for regeneration of epidermal cells? Option A melanocytes, option B keratinocytes, option C Langerhans cells, option D Merkel cells. The correct answer here is B, keratinocytes. Please kindly read in details about melanocytes because it's a commonly asked question related with melanin. Langerhans also is a very commonly asked questions. Merkel cells also. Kindly read in details. If you are preparing any upcoming exams, especially NORCETs, kindly go through all this. Next question. Which of the following is also known as swimmer's ear? Option A amblyopia, option B otitis media, option C otitis externa, not external here, externa, option D is style, not style. The correct answer here is C, otitis externa is also known as swimmer's ear. Next question. What is the main objective of universal precautions? Option A prevent the spread of blood-borne pathogens, option B maintain peaceful environment, option C promote defense mechanism in the body against infection, option D promote comfort. The main objective of universal precaution is correct answer here is A, prevent the spread of blood-borne pathogens. Next question. How long does the distensible vagina takes to involuted? Involution of uterus during perineum. We have this there is a topic perineum. If we know like how long is the period of perineum, then we can easily guess this answer. Correct answer option A 13 to 15 weeks, option B 9 to 12 weeks, option C 4 to 6 weeks, option D 0 to 3 weeks. Correct answer here is C, 4 to 6 weeks. Next question. Which one of the following is called second phase of nociceptive pain? Option A modulation, option B transduction, option C transmission, and D perception. The correct answer here is C, transmission is a second phase of nociceptive pain. We'll be discussing in brief about nociceptive pain. There are 4 phases of nociceptive pain. The first one is transduction. In transduction, there is tissue damage causes the release of substances that stimulate the nociceptors and initiate the sensation of pain. In transmission, which is second phase, involves movement of the pain sensation to the spinal cord. Third phase, perception, occurs when impulses reach the brain and a pain is recognized. Option D. Phase 4, modulation, occurs when neurons in the brain send signals back down the spinal cord by the release of neurotransmitters. So these are the 4 phases of nociceptive pain. So second one is the transmission. So correct answer here is transmission. Next question, who proposed the model of preventive psychiatry in community mental health nursing? Option A, N. Vick, option B, Dr. Ray, option C, Philip V. Final, option D, Gerald Kaplan. The correct answer here is D. Gerald Kaplan is the person who proposed the model of preventive psychiatry in community mental health nursing. We'll see who is this N. Vick. N. Vick is the person who founded the PGI psychiatric department in 1963 and he has served as AIMS and WHO. Philip P. Final is known as the father of modern psychiatry. This is also very commonly asked question. Kindly noted, who is the father of modern psychiatry is Philip P. Final. Next question, which of the following organ enlarges due to malarial infection? Due to malarial infection, which of the following organs enlarge? Option A, spleen, option B, pancreas, option C, stomach, option D, liver. The correct answer here is A, spleen. Next question, which one of the following is called endometrium of the pregnant uterus? Option A, amnion, option B, morula, option C, decidua, option D, chorion. It's very simple question, but I think we all know this answer is C, decidua. What is the purpose of evisceration? Option A, saving the life of fetus, option B, prevent pregnancy, option C, diminish the bulk of fetus, option D, resuscitate both mothers and fetus. The correct answer here is C, diminish the bulk of fetus. This is also a very commonly asked question. A hollow or cracked pot sound is heard during percussion of skull. It's called option A, Babinski sign, option B, Chadwick sign, option C, sun setting sign, option D, Maswen sign. Babinski sign is present in the newborn baby, that is in the food. Chadwick sign is a purplish discoloration of the vagina. Sun setting is present in hydrocephalus. We'll be seeing this. This is a sign of increased intracranial pressure. White bulging fontanelle, increased head circumference. Sunset eyes. This sunset eyes is present in hydrocephalus patient. See the image here. This is sunset eyes. So this also they might ask question. Babinski sign occurs when stimulation of lateral palm aspect of the foot leads to extension, dorsiflexion or upward movement of the big toe. This is Babinski sign. It is negative. It is positive in newborn and is normal, and in adult if it is positive is considered as abnormal. This is also a very commonly asked question. Next question. Which one of the following is responsible for color discrimination in eye? Rods. Option B, vitreous humor. Option C, aqueous humor. Option D, cones. Like which part of the eye which helps us in differentiated different color, red, blue, green, like that. We might be confused about A or and D. Correct answer here is D. Cones helps us in color discrimination. Next question, which one of the following is called bulimia nervosa? Option A, somatoform disorder, sleeping disorder, eating disorder. This is a very common, simple question. The correct answer here is C, eating disorder. This is also a very simple question. Which of the following, what is the process of complete elimination or destruction of all microorganisms including its spore? This is definition of sterilization. So the correct answer here is D, sterilization. I think we all know this answer. This is a very common question. Which of the following condition that results that reveals not results here reveals boot shape heart in radiography while doing X-ray? The part of which of the following disease reveals boot shaped heart in radiography? Option A, coarctation of aorta. Option B, pulmonary stenosis. Option C, tetralogy of Fallot. Option D, aortic stenosis. The correct answer here is C. In tetralogy of Fallot, boot shaped heart is present. We'll see the X-ray. This is X-ray of TOF or tetralogy of Fallot. It's like a boot shape. That's why it is known as boot shape. The four defects also of tetralogy of Fallot of the four defects of tetralogy of Fallot are as follows: VSD, that is ventricular septal defects; pulmonary stenosis, overriding aorta, right ventricular hypertrophy. This also very commonly asked question. Which of the following fall under the TOF? Next question, which one of the following that forms a barrier between the host and germs? Option A, sterilization. Option B, personal protective equipment. Option C, isolation. Option D, disinfection. The correct answer here is B, PPE. Personal protective equipment forms a barrier between the host and germs. This is interesting questions. Which one of the following is a hormonal disorder caused by a high level of cortisol in the blood? Option A, pituitary dwarfism. Option B, Cushing syndrome. Option C, acromegaly. Option D, Addison disease. Correct answer here is B. High level of cortisol in the blood cause Cushing syndrome, whereas low level of cortisol cause Addison disease. So this is vice versa. Cushing syndrome is due to high level of cortisol. Low level of cortisol cause Addison disease. And this acromegaly occurs when the pituitary gland produces too much growth hormone, excessive growth hormone over a long period of time, called acromegaly in adult. That is, in adult is called acromegaly. If there is excessive presence of a growth hormone in childhood, it is called as gigantism. The name only change. If it is present in childhood, it is called gigantism. If it is in adult, it is called as acromegaly. Next question, what is the process of separating the harmful and harmless waste? Decontamination, transportation, segregation, disposal. Correct answer here is C, segregation of waste. Option C is correct answer. This also is interesting answer. Questions, which of the following is a screening method of cervical cancer for a woman aged between 30 to 65-year-old? Option A, pap smear, pap test alone. Option B, colonoscopy and double contrast barium enema. D, CBE. Option C, mammography. Option D, co-testing with HPV test and pap test. The correct answer here is D, co-testing with HPV test and pap test. Next question, which of the following is anti-manic drug? Option A, diphenhydramine. Option B, lithium carbonate. Option C, epipramine. Option D, verapamil. Correct answer here is B, lithium carbonate. This is also a very simple question. They use as normal lithium level, therapeutic level of lithium. Next question, which of the following condition that has recurrent sudden episodes of irresistible sleep attack of short duration? Option A, insomnia. Option B, circadian rhythm sleep disorder. Option C, hypersomnia. Option D, narcolepsy. The correct answer here is narcolepsy. Next question, disparity in relation between the fetal head and maternal pelvis is called contracted pelvis. Option B, unstable lie. Option C, CPD, which is cephalopelvic disproportionate. Option D, malposition. The correct answer here is C, cephalopelvic disproportion. CPD is a medical issue that can arise during childbirth. It occurs when a baby is having trouble getting through the birth canal. The baby may be very large or in a difficult delivery position, or the mom's pelvis may be too small for the baby to pass safely. That is CPD. So the correct answer here is CPD. Next question. Which one of the following is called a primary link in the development of disease? Option A, host; B, agent; option C, health; option D, environment. The correct answer here is B, agent. Which of the following sequence is called a model of communication process? This is a communication question, CET question. Option A, source, channel, message, receiver. Option B, source, channel, receiver, message. Option C, source, message, channel, receiver. Option D, source, message, receiver, and channel. The correct answer here is, first we have to get a source of information, then a message being created through a channel, and finally the receiver receive message. Option C is correct answer. This is interesting question. What is called thanatophobia? Option A, fear of marriage. Option B, fear of fire. Option C, fear of death. Option D, fear of being buried alive. Correct answer here is thanatophobia is fear of death. We'll see. Pyrophobia is a term related with fear of fire. Pyrophobia is a term for fear of fire. Fear of marriage or fear of commitment or fear of marriage is known as gamophobia, where a fear of being buried alive, it is called as taphiphobia. Taphiphobia is a persistent fear of being buried alive. Next question. Which of the following drug is prescribed to an antenatal mother for fetal lung maturation? Option A, bromocriptine. Option B, metoprolol. Option C, metoclopramide. Option D, metamethasone. Correct answer here is D, metamethasone, which is a steroid. Next question, which is the last question for today. Which bacterial toxin that blocks the acetylcholine at neuromuscular junction? Option A, salmonella. Option B, clostridium. Option C, botulism. Option D, staphylococcus. The correct answer here is C, botulism. This is it for today. Thank you. Kindly like, share and subscribe.